My name is Sangeeta Raja. I actually have been working in the development area for the last 30 years. I started my career as a United Nations volunteer and then worked for UNICEF, USAID, GSI, and then World Bank. Since then, I have created my own little company, which is women minority-based company in the US. And really, the purpose of this company is to really work with partners who are on the ground, really connecting with them and trying to come up with solutions that would work, bringing innovations from the private sector. And so really serving as a bridge between the private sector and the public sector. So that's the purpose of this company. I normally work with institutions that are already based in developing countries or low middle income countries. And I usually find a partner in the private sector, usually based in the high income countries.
So can you tell me, first of all, what has been the biggest challenge that you would say you've faced in your career to date?
Generally, in terms of the career, I think is trying to get solutions that are innovative, that could really change how we think about a problem and really applying it to the realities of a developing country. So for instance, the example of this AI work that we've been doing, the whole concept of AI is, first of all, very difficult. And trying to get it connected to really a public sector situation where most of the systems are very manual driven was a real hard to connect those two components. So really it's trying to come up, we know the solutions are there, but then the reality on the ground is very, very different and difficult, and trying to match those has been the biggest challenge.
Yeah, and it seems like over the past few years, we've seen a big increase of people moving towards more digital tools, more AI, more online platforms. Can you tell us a little bit about the shift as you've seen it?
Yeah, I think that the shift started almost in the 90s in the area of the supply chain work, where we started to realize that we really need visibility in the area of really understanding where the inventory was. And I think sort of trying to create IT systems that would actually start capturing that information. I think that's where the trend is kind of started and has really moved into the health information management systems. And now I think we're even discussing about trying to connect with getting patient data and really linking the patient directly to digital stuff. I think this is a trend that we don't have a choice. It needs to happen. It needs to move forward. And I think it will really help in really better understanding the trends of what's really going on. I mean, before it was really based on our perceptions or our experience. And now we can really rely on data that can drive that decision making.
Applying that to health campaigns, how have you seen that trend impact the planning or the way that health campaigns have been conducted?
So actually, I was really surprised to see very few digital application in the whole health campaign planning process. I've been involved in health campaigns for over the 30 years, and we used Excel spreadsheets, Word documents, and I thought I left that for over 10 years and thinking things would have changed, and was very surprised when I was looking at it again to realize that actually things have really not changed. And so I think there's a great opportunity to start really bringing digital capabilities in the area of microplanning.
So moving into microplanning specifically, can you talk a little bit about why it's important or some of the work that you've done in microplannings for campaigns?
Yeah, so right now, I think the way microplannings are done, it takes a lot of people who meet in various committees to really start planning these exercises. And this effort takes on every year after year after year. So there's a lot of opportunity to really try and make the whole process more efficient as we go along through the system, and trying to reduce the number of people who are involved, the number of tasks that are repeated again and again and again. So I think there is a need to change how we do business in terms of the microplanning process so that we are not doing the same things again and again. And so I think the tool that we have developed is hoping to try and cut all those processes that are continuously repeated.
So, are there any campaigns that you've been a part of that you thought had particularly good planning structures, or ones that you thought, oh, I can see a need for improvement in this area?
I think all campaigns do have a good planning structure in the sense that they have committees who are organized, there groups that are organized. So that is actually in a good thing, because what you've done is you've got to buy in across departments who are working together to really solve a one-time event. So I think those processes we do not want to lose. The fact that there's a collaboration across departments, collaborations against people. So those things are good. What I think needs to be changed is how we manage the nitty gritty of the data itself or the planning itself. I think if we can improve those components, think would be really good. But I really do like the idea of the collaboration, and that's one of the things that we also in the platform wanted to make sure that as many people involved in the AI, in the microplanning, are still having access, that they're not being cut off in the microplanning, because we absolutely need the collaboration across departments, for the health campaigns to work, especially integrated health campaigns.
And this has actually led you to develop a tool for microplanning. Can you tell us a little bit about it? Just a short summary of what it is and how it works?
So basically, what the microplanning tool does is actually it's an online web-based platform that enables individuals to initiate the planning process of the health campaign. So they're able to enter all the data into one system that is actually visible across committees and across people. So everybody's working under the one assumption and one approach. It has also taken out many of the factors that you had to do in the manually, like forecasting for medical supplies, forecasting the target population one should be, using for the campaigns and stuff. It has taken all those processes out and has basically enabled the AI machine to do that for you. So trying to take away work that should be really be done by machines. So we've tried to bring those two processes together to try and help with the whole microplanning campaign planning process.